The man was dying in front of 12 people and not one of them moved. His lips were blue. His chest rose on the left, stayed flat on the right, and every breath he pulled in just made the pressure worse. The monitor was screaming. The trauma bay smelled like blood and antiseptic, and something else. That particular silence that falls over a room when trained professionals forget what they're trained to do. Dr. Randall Pierce stood at the foot of the bed with a chart in his hand and nothing in his eyes. Emily Carter uncapped a ballpoint pen with her teeth, found the space between the second and third rib, and pushed. The air hissed out. The man's chest dropped even. His oxygen climbed from 61 to 94 in 40 seconds. Emily straightened up and said, "Somebody want to get me a chest tube now?" Nobody moved. They were all staring at her. If this story has you on edge already, subscribe, hit like, and drop the name of your city in the comments below. I want to see exactly how far this story travels. Now let's go back to the beginning. Emily Carter had been at Ironwood Regional Hospital for 14 months, and in that time, she had learned 3 things about the place. First, the parking garage on the east side flooded every time it rained, and nobody had fixed it in 3 years because the facilities manager was Dr. Pierce's college roommate. Second, the nurses' lounge on the 3rd floor had a broken microwave that everyone complained about, and a coffee machine that nobody touched because the filter hadn't been changed since the previous administration. Third, if you were a nurse at Ironwood, particularly a young one who asked too many questions, you were furniture. Useful when needed, invisible when not, and replaceable the moment you became inconvenient. She had learned these things the hard way. She showed up the first week with her Army discharge papers and 6 years of combat medic experience and a certification stack that most ER physicians didn't bother to maintain. And the charge nurse, a woman named Bev Hollis, who had been at Ironwood for 22 years and wore that fact like a medal, had looked at Emily's paperwork and said, "That's military, honey. This is a real hospital." Emily hadn't said anything to that. She'd smiled, nodded, found her locker, and started her shift. That was how she handled most things, quietly, with her jaw set slightly tighter than it needed to be. She was 31, 5'6", with brown hair she kept pulled back in a braid that got messier as the shift went on, and a habit of pressing her thumbnail into her palm when she was frustrated, something she'd picked up overseas when the alternative was saying something that would land her in a CO's office. Her hands were capable in the way that hands get when they've done hard things many times. Not graceful, capable. There's a difference. She'd done 2 deployments in eastern Afghanistan and 1 in a forward operating base outside Mosul, and she'd seen things that people in civilian medicine only read about in trauma literature. She'd kept a Marine alive for 6 hours with improvised equipment and a blood pressure cuff while waiting for a medevac that came late. She'd performed a needle thoracostomy on a dirt floor in the dark, using a flashlight held in her teeth. She'd intubated a soldier with a shattered jaw, while someone 300 yards away was actively trying to kill both of them. None of that was on her employee badge. Her employee badge said, Emily Carter, RN, Emergency Department. That was what she was here, a badge, a set of hands, someone to start IVs and document vitals and notify the attending when something required an actual decision. She understood the hierarchy. She'd lived inside hierarchies her whole adult life. The Army ran on them. Hospitals ran on them. The difference was that in the Army, the hierarchy was supposed to reflect competence. Here, it mostly reflected time in seat and proximity to the right people. Dr. Randall Pierce was the undisputed center of that gravity. He was 54, broad-shouldered in a way that had gone slightly soft. With silver hair he wore combed back in a manner that most people read as confident and Emily read as practiced. He'd been at Ironwood for 19 years. He had a plaque outside his office. He had a parking spot with his name on it. He had a way of entering a room that made residents stand up straighter, not because he inspired them, but because they'd learned what happened when he noticed them slouching. He was not a bad doctor. Emily had watched him work enough to know that. He was competent, thorough, appropriately aggressive when the situation called for it. But there was something underneath the competence, a need to be the most important person in any space he occupied, that occasionally got in the way of the medicine. She had felt him noticing her since her 3rd week. Not the way some men noticed her, which was its own problem she'd long since learned to manage. This was different. This was the way a person notices something that doesn't fit where it's been placed. She asked too many questions. She caught things. She had a habit, developed over years of field medicine, where there was no attending to consult, of acting on what she observed rather than waiting for permission. And even when she stopped herself, caught the impulse and held it, made herself page the physician, made herself document and defer, he seemed to sense it, the restraint, the pause, and he didn't like what it implied. By month 3, he had written her up twice. Once for failure to follow protocol, when she'd pushed saline on a patient whose blood pressure was crashing faster than the order had come through. Once for insubordination, when she'd asked, in front of 2 residents, why a sepsis patient's antibiotics had been delayed 4 hours after the initial assessment. Both write-ups went in her file. Both were worded precisely enough to be defensible. Neither was quite the truth. She didn't fight them. She signed the acknowledgement forms and kept showing up. "You need to be more careful," said Marcus Webb, one of the overnight nurses who'd been at Ironwood 6 years and had the particular worn-down quality of someone who'd made his peace with things. He was 43, black, originally from Memphis, and he'd been the closest thing to a friend she'd found here. "Pierce doesn't forget." "I haven't done anything wrong. That's not what I said." He was restocking the supply cart, not looking at her. "I said be careful. Those aren't the same thing." She knew he was right. She filed it away alongside the other things she knew and couldn't use. The morning of October 14th started like most mornings. She clocked in at 6:58, changed into scrubs in the locker room, checked the board. 8 patients in the waiting room, 2 in triage, 1 still being worked up from overnight, a 40-year-old with chest pain that the night team had kept for observation. The ER was that particular kind of busy that wasn't quite chaos, but had the texture of something that could become chaos quickly. She took her assignment from the charge nurse, Bev, who handed her the tablet without making eye contact, and started her rounds. The morning moved. She pushed meds, changed dressings, talked a 67-year-old man through a procedure he was scared of by telling him her father had had the same thing done and was fine, which wasn't true, but which was what he needed to hear. She caught a potassium level on a post-surgical patient that was lower than it should have been and paged the attending, who thanked her in the distracted way attendings thank nurses, meaning they noted the information and forgot the source. At 9:40, the ambulance bay doors blew open. She heard it before she saw it. The particular urgency in the way the paramedics moved, the pitch of someone calling for a trauma bay. She was coming around the corner of the nurses' station when the gurney came through, and her eyes went to the patient the way they always did, reading the situation in pieces before her brain assembled it into a whole picture. Male, mid-40s, well-built, the kind of fit that took work, pale in a way that had nothing to do with skin tone and everything to do with blood pressure. He was conscious but only just. His eyes were open and tracking, but he wasn't focusing on anything. His left hand was at his side. His right hand kept moving toward his chest and then falling back. The gesture of someone whose body knows where the problem is even when the mind has mostly given up. "GSW to the right chest," the paramedic was saying. "Hypotensive on scene, systolic 68 on arrival, decreased breath sounds right side, SATs dropping." "Bay 3!" someone called out. Emily moved with the gurney. It was automatic, the same thing she'd done in the field 100 times, falling in with the movement, hands already reaching, already thinking 2 steps ahead. The trauma bay was controlled chaos, which is the only kind of chaos that's survivable. 2 residents converged, and RT grabbed the oxygen equipment. Someone was cutting the man's jacket away. His shirt underneath was dark, drenched. The wound was to the right side, just below the armpit. Not the worst entry point, but the placement mattered. And the placement said tension pneumothorax the way that certain clouds say rain before anyone has bothered to check the sky. She watched his breathing, left side rising, right side barely moving. The oxygen monitor was at 74 and falling. Dr. Pierce came through the door. He took the scene in, accepted the chart one of the residents pushed at him, and Emily watched him do the thing she'd seen him do before. The brief stillness that most people probably read as assessment, but that she had come to understand was something different. Not indecision, exactly. More like the moment of adjustment when you're used to being the one who decides, and the situation is moving faster than your authority. "Get me a crash cart," he said. "What's his pressure?" 62 systolic, someone called. "Bag him." The RT moved in with the mask. The resident was reaching for a line. Emily was watching the man's chest. "He needs a needle," she said. Not loud, just clear. Nobody looked at her. "He's got a tension pneumo," she said, louder. "Right side. He needs decompression now." "Let the attending manage the airway," Bev said from behind her. It was almost reflexive the way she said it, like a response to a stimulus that no longer required thought. Emily looked at Pierce. He was looking at the monitor. The number had dropped to 61. The RT was having trouble with the mask seal. One of the residents was on the wrong side of the bed, in the way of the other one. The man's lips were going blue. 60 seconds ago, they'd been pale. Now, they were blue. She had a pen in her breast pocket. She'd put it there that morning out of habit. She always kept a pen there, a reflex from the field where you wrote on your glove, on your forearm, wherever you needed to write. It was a ballpoint, cheap, the kind of pen that came in the plastic bag of supplies they handed new employees. She uncapped it with her teeth. "Emily," Bev started. She found the landmark. Second intercostal space, mid-clavicular line. She'd done this in the field with actual needles, and once, memorably, with a piece of IV tubing she'd improvised. The pen barrel would hold for 30 seconds. Long enough. She pushed it through. The air came out in a rush she could hear. A hiss, and then a pop of pressure releasing, and the man's chest, both sides of it this time, rose together. The monitor showed 68, then 72, then climbing. His color was wrong still, the blue receding slowly, but his oxygen was at 79 and moving in the right direction. "Chest tube," she said, keeping her hand steady on the pen. "Now. And he needs a line on both sides." The room had gone quiet in the way rooms go quiet when something happens that people are still processing. The resident who'd been on the wrong side of the bed had moved to the right side. The other one was already reaching for the chest tube tray. The RT had gotten the mask seated properly. Then Pierce's hand came down on her shoulder. "Step back," he said. It wasn't loud. It was a very specific kind of quiet, the kind that means something is being suppressed, and everyone in the room can feel the pressure of what's being suppressed. "I need to hold this until the tube is in," she said. "I said step back." He wasn't looking at the patient. He was looking at her. "You're done here." His oxygen is at 82 and climbing. If I remove security, he raised his voice for the first time. "I need security in Trauma Bay 3. She felt the room shift. Not physically. The people in it barely moved. They were professionals, and they had a patient to deal with. But something moved in the air, the way air moves before a storm system arrives. She saw the residents exchange a look. She saw Bev's expression, which was not surprise and not disapproval and not quite sympathy either, just the face of someone watching something that has happened before. "The chest tube's in," the resident said quietly. "You can let go." She let go, stepped back, kept her eyes on the monitor, 91, 93, because that was what mattered. That was the only thing that mattered. 2 security guards came through the door. The hospital had a total of 6, and Ironwood was not the kind of place that used them in clinical areas. Seeing them in the trauma bay felt wrong, in the same way that seeing certain things feel wrong. Not immediately dangerous, just misaligned. "Escort Nurse Carter out of the trauma unit," Pierce said. He'd already turned back to the patient, accepting the stethoscope from one of the residents, performing the examination that should have happened 2 minutes ago. "And have Bev call HR. "Dr. Pierce," one of the residents started. "I didn't ask for input, Dr. Reyes." The security guards looked uncomfortable. One of them was a young guy Emily had seen in the cafeteria. Darnell, she thought his name was. She'd talked to him twice. He looked at her with an expression that mixed professionalism with something that was close to apology. "Ma'am, if you'll come with us." She went. There was no point in not going. The tube was in, the patient was stabilizing, and fighting Pierce in the trauma bay while the monitors were still alarming was not the kind of thing that ended well for anyone involved, least of all her. She walked out with her hands at her sides and her thumbnail pressing into her palm, and the sound of the monitors following her down the hall. In the corridor, one of the nurses she barely knew, a per diem named Rosa who worked 2 days a week and mostly kept to herself, pressed her lips together and looked away when Emily passed. not from cruelty. From the recognition of something she didn't have the capacity to confront. Emily had seen that look before. In other contexts, other places. The look of someone who knows the wrong thing is happening and has calculated that they are not the person to stop it. She made herself breathe evenly. Darnell walked slightly behind her rather than next to her, which was either professional or kind or both, and she appreciated it without saying so. The other guard, older, someone she didn't know, walked ahead, and she focused on the back of his head and kept walking. The trauma unit had a set of double doors at the end of the main corridor, and beyond them was the general ER floor, and beyond that were the administrative areas and the entrance. She was being walked toward those doors with the clear intention of being walked all the way out of the building. 14 months. She'd been careful. She'd filed the right forms, she'd deferred when deferring made sense. She'd swallowed down the thing in her chest that wanted to argue every time she saw a slower or worse decision being made when the faster or better one was obvious to her. She'd tried. She was still thinking about the patient, male, mid-40s, the kind of fit that was professional rather than recreational. The jacket they'd cut away had been good quality, not hospital gown quality, not scrubs quality, the kind of jacket that cost money and served a purpose beyond aesthetics. Dark, close cut, with something at the left hip that hadn't been there when the trauma team had lifted the cut sections away. She turned this over as she walked. Something nagged at her, the way things nagged at her in the field when details didn't add up. The paramedic had said GSW, gunshot wound. In Harwick, the city of 300,000, not small but not large, the kind of city with one level 1 trauma center and 2 level 2s and a crime rate that was average. Gunshot wounds happened, but they happened in certain contexts, and the context of this man wasn't matching any of the usual ones. The doors opened. She stopped. Outside, through the ER's main entrance, through the glass she could see it clearly. There were vehicles she didn't expect. Black SUVs, 4 of them visible, more suggested by the angles. The kind of SUVs that were not ambulances, not police cruisers, not any of the vehicles that normally parked in a hospital's emergency drop zone. And people in suits moving fast in the kind of organized way that said, Federal, said Protective Detail. Said something she hadn't expected to be part of her Tuesday morning. Darnell had seen them too. He'd stopped at her shoulder, and the older guard had stopped, and for a moment all 3 of them were just looking through the glass at what was unfolding outside. What the older guard started. The doors at the far end of the corridor opened, the ones that led in from the ambulance bay, and 3 people came through them that were not hospital staff and not paramedics. They wore dark clothing, carried weapons she recognized. The configuration, the posture, the way they moved, and they moved to the entrance desk and said something that made the administrative clerk go very still. One of them was already on the phone, or not a phone, a radio, compact and military grade, held at the jaw. Emily watched them scan the room, watched one of them look at the board, the patient board, the names and bay numbers, watched him point at something and turn to the other 2. She knew what bay they were pointing at. She looked at Darnell. That man in bay 3, she said quietly. Yeah, Darnell said. We need to go back. He looked at her. Then he looked at the men in dark clothing, now moving with purpose through the ER, and then back at her. Pierce said, I know what Pierce said. She kept her voice even. I'm telling you what's coming. She was already turning when the announcement came over the building intercom. Not a page, not the usual automated voice, but a live voice. Someone at the security desk, reading the words with the particular inflected calm of someone reading something they've never had to read before. Attention Ironwood Regional Hospital. This is a security notification. All entrances are currently restricted. Staff are asked to remain in their designated areas until further notice. This is a security notification. The double doors behind her, the ones to the outside, were already locked. She could see the magnetic seal engage along the frame. Through the glass, 2 of the suited figures were taking positions on either side of the entrance. The hospital was in lockdown. And somewhere in Trauma Bay 3, the man whose chest she'd opened with a ballpoint pen was the reason why. The intercom was still cycling through the announcement when Emily made her decision. It wasn't a dramatic decision. It didn't feel like one. It felt like the same kind of decision she'd made dozens of times in the field, The moment when the situation exceeds the protocol and you have to choose between what you're supposed to do and what actually needs to happen. She'd learned a long time ago that freezing in that gap was its own choice, and usually the worst one. She turned around and walked back toward the trauma unit. Darnell didn't stop her. She wasn't sure if that was because he'd processed what was happening faster than the older guard, or because some part of him recognized that the authority structure of the last 10 minutes had just been overtaken by something larger. Either way, he fell into step slightly behind her, and the older guard, whose name tag said Greer, stood at the locked entrance doors and watched them go with the expression of a man who had decided that this was above his pay grade and was comfortable with that decision. The double doors to the trauma unit were still unlocked from this side. She pushed through. The bay was different than she'd left it. Not in the clinical sense. The resident was still managing the chest tube. The RT was still monitoring the airway. The monitors were reading numbers that were better than they'd been 12 minutes ago. But the energy in the room had shifted. Two of the suited figures she'd seen in the outer ER were now standing just inside the trauma bay doors, and they were not looking at the patient. They were scanning the room with the systematic efficiency of people whose job involved knowing where every person in a space was at every moment. Pierce was at the patient's right side, talking to one of them. She couldn't hear what he was saying, but she recognized the posture. The slightly lifted chin, the deliberate calm, the way he positioned himself as the authority in the room to people who had not yet formed an opinion of him. She stayed near the door and watched. The man in the bed, their patient, the one whose chest she'd opened with a pen, had more color than before. Not much, but enough. His oxygen was holding at 94. The chest tube was draining steadily. He was still not fully conscious, but the quality of his unconsciousness had changed. He'd moved from the limp absence of someone whose body is shutting down to the heavier stillness of someone whose body is working on the problem of staying alive. One of the suited figures, a woman, mid-40s, with the kind of contained energy that said she was in charge without requiring her to announce it, stepped forward from the corner of the room where she'd been positioned. She looked at Emily directly. "Your staff?" "Emily Carter, ER nurse." "You were with this patient on arrival?" "I was in the room, yes." The woman's eyes moved briefly to the two security guards behind Emily and then came back. "I'm going to need you to stay in the unit. Nobody leaves this floor until we've established a full account." "I was being escorted out when the lockdown started," Emily said. Something shifted in the woman's face, a recalibration, small and fast. "Escorted out by who?" "Doctor. Pierce requested it." Pierce had heard his name. He turned from the other agent. His expression when he saw Emily still standing in the bay was controlled, but the control required visible effort. "She was removed from this trauma bay for a protocol violation," he said, directing this at the female agent rather than at Emily. His voice was steady and reasonable and carried the particular tone of someone who had practiced being reasonable in high-stakes situations. "I made that call as the attending of record. And I'm asking her to stay," the agent said, not raising her voice, just making clear that she was not Pierce and the decision was no longer his. The silence that followed was 4 seconds long. Emily counted them, the way she'd learned to count in situations where the next few seconds determined a great deal. Pierce looked at the agent, at Emily, back at the agent. "Of course," he said. Her name was Special Agent Vera Nolan, and she ran her interview the way Emily imagined a very experienced, very tired person runs an interview when they don't have time to waste. She'd pulled Emily into the small consult room off the main trauma corridor, a room with one window, a table, 2 chairs, and a wall-mounted screen someone had left displaying a patient chart that had nothing to do with any of this. Nolan sat across from her with a tablet and a pen she didn't seem to use for writing, so much as for keeping her hands occupied. "Walk me through what happened from the time the patient arrived," she said. Emily walked her through it. She didn't editorialize. She'd learned that lesson in the Army, in the after-action reports where the difference between an accurate account and a self-serving one was often the thing that determined what happened next. She described what she'd observed, what she'd assessed, what she'd done, and why, in the order it had happened. Nolan listened without interrupting, which Emily appreciated. When she finished, Nolan said, "The pen." "Standard ballpoint. It was in my pocket." You improvised a needle decompression with a ballpoint pen. The barrel creates a temporary pressure valve. It's not ideal, but it's faster than searching for a 14-gauge needle in a room where everyone's frozen. I've done it before. Where? Emily held her gaze. Forward Operating Base outside Mosul, 2019. Something in Nolan's expression shifted again. That same small recalibration. You were deployed. 6 years Army, combat medic, 2 Afghanistan rotations, 1 Iraq. Nolan wrote something. Not on the tablet. She had a small notebook that she'd produced from somewhere, and she wrote in it with the pen she'd apparently been reserving for exactly this purpose. And Dr. Pierce called for your removal before or after the procedure was complete. After. He said, step back, while I still had my hand on the pen maintaining the decompression. I held it until the chest tube was in. He asked you to step back while you were the only thing keeping the patient's lung decompressed. Yes. Nolan looked at her for a moment without writing anything. Okay, she said finally. Wait here. The consult room was not comfortable, but Emily had spent time in less comfortable places waiting for things she couldn't control, so she sat in the chair and looked at the wall, and let her mind go through what she knew. The suited figures were federal. The vehicles outside were federal. The speed and organization of the lockdown, the way the entrances had sealed, the way Nolan had positioned people in the clinical spaces, set a coordinated response to a specific situation rather than a general emergency. Someone had been activated well before the ambulance arrived at Ironwood, which meant someone had known the patient was coming here, or known he was in trouble, or both. The patient himself, mid-40s, physically fit in the functional way rather than the aesthetic way, jacket that cost money and served a purpose. The thing at his left hip that hadn't been a phone. She'd recognized it even in the chaos of the trauma bay, even cut away from the jacket. A holster, empty, because whatever had been in it had presumably been secured by the paramedics or whoever had been on scene before the ambulance. She turned that over. She thought about what a man who wore a jacket like that and carried a weapon and arrived at a hospital in the company of federal agents probably did for a living, and she thought about the word Nolan had used when she'd addressed her colleagues on the radio. Not suspect or victim or even patient, but the principal, which was a word Emily had heard before in a specific and narrow context. She was still thinking about this when the door opened and Nolan came back in, and behind her was someone Emily didn't recognize. A man in his early 60s with the bearing of someone who had spent a very long time in rooms where decisions were made, and behind him 2 others who were clearly subordinate to him in ways that had nothing to do with age. Nolan said, "Deputy Director Harlan Mack, Office of Protective Operations." Emily stood. Not quite at attention. She wasn't in the Army anymore, and she'd made herself stop doing that. But something in her posture adjusted without her consciously deciding it. Mac looked at her the way he probably looked at most things. Quickly, thoroughly, making assessments he would not share unless sharing them served a purpose. "You're Carter," he said. "Yes, sir." "Sit down." He took the chair Nolan had vacated. Nolan stood. "I'm going to tell you who's in that trauma bay, and then I'm going to ask you some questions, and I need your answers to be accurate. Not helpful, not reassuring, accurate." "Understood." "The man you treated is Commander Victor Salter. He heads our field protection unit for the Eastern Corridor. He was on assignment when he was shot." Max stopped. He had a way of stopping that filled the pause rather than leaving a gap in it. The operation he was running, if it had gone sideways without him, would have had consequences of a kind I am not going to describe to you in this room. He needed to live. He's alive. "I need to understand why," Emily told him. Shorter version this time, because she could read what he needed. Not the full clinical picture, but the decision tree, the specific choices that had been made and why. When she finished, Mac was quiet for a moment. "Pierce did nothing," he said. "Not a question. He was managing the room. The assessment of the tension pneumo was mine. And the intervention. Yes. How long have you been at this hospital? 14 months? Before that? Army, combat medic." He looked at her for 3 seconds. "What rotations?" She told him. He didn't write anything down. She got the sense that whatever she said was going to be verified, and the verification would happen faster than she expected. Agent Nolan is going to get your full contact information, he said, standing. You don't leave the building until I clear it. You don't speak to anyone outside this room about what I've just told you about Commander Salter. You understand? Yes. He moved toward the door, then paused with his hand on the frame. He turned back and looked at her with the direct, unsparing quality of someone who did not have time for anything other than the truth. Good work, he said. Then he was gone. She sat in the consult room for another 40 minutes. She could hear things through the door, movement in the corridor, voices too low to parse, the rhythmic announcement of the lockdown cycling every 15 minutes over the intercom. At some point, someone brought her a paper cup of coffee, and she drank it without tasting it. She thought about Marcus, who was somewhere in the hospital on his overnight-to-morning overlap, and wondered if he'd figured out what was happening. She thought about Dr. Reyes, the resident who'd said her name when Pierce ordered her out. Just her name, just Emily. Before Pierce had cut him off, but enough to say that someone in that room had registered that the wrong thing was happening. She thought about Pierce. She'd worked for men like him before, not in kind but in structure. Men who understood that authority was a resource that had to be defended continuously or it depreciated. The Army had them too. The difference was that in the Army, a catastrophic enough failure in the field had consequences that were real and immediate and hard to paper over. In a civilian hospital, there were layers. There were committees and reviews and HR processes designed for situations where the harm was ambiguous enough to be argued. Pierce had used those layers effectively for a long time, and she had no reason to think he wasn't already thinking about how to use them now. She knew what he was going to say. She could construct it without effort because she'd heard variations of it her whole career. He would say that he had been in the process of assessing and that Emily had interfered before he could complete that assessment. He would say that improvised procedures by non-physician staff created liability and set dangerous precedent. He would frame her removal from the bay, not as the suppression of a life-saving intervention, but as a necessary enforcement of clinical hierarchy in a high-stakes situation. He would say all of this in the reasonable, measured voice of a man who has spent 19 years practicing the art of being believed. And then there was the footage. Trauma Bay 3 had cameras. All the trauma bays did. It was standard. Clinical documentation, liability protection, training review. Emily had been aware of those cameras on the way in and aware of them throughout. She had not performed the decompression for the cameras, but she had not been unconscious of them either. She thought about what the footage showed. Pierce with the chart. Pierce at the foot of the bed. The monitors climbing into the danger zone while the room held that particular breathless stillness of deferred decision. And then her with the pen. She thought about how long it would take someone to pull that footage. The answer, apparently, was 40 minutes, because that was when the door opened again, and it wasn't Nolan. It was Nolan and two other people she didn't recognize, one of whom was carrying a laptop, and behind them was a third person who she did recognize, because he worked in the hospital and she'd seen his face at administrative events and in the hallway near the executive suite. His name was Richard Albee, and he was Ironwood's chief operating officer, and his expression was the expression of a man who had been pulled out of a meeting he was not done with and placed into a situation he did not fully understand yet, but was becoming increasingly certain he was not going to enjoy. "Ms. Carter," Nolan said, "we'd like you to look at something." The laptop showed this footage from Trauma Bay 3. It was the clinical camera angle, elevated, slightly wide, the kind of shot designed to capture the whole bay for documentation purposes. Emily watched herself enter the frame behind the gurney, watched the residents converge, watched the RT. She watched Pierce come through the door. She didn't say anything while it played. She watched herself watching the patient's breathing. She watched herself speak. Twice, she could see the words and the movement of her mouth. And then she watched the room not respond, and then she watched herself pick up the pen. Albee made a sound, not a word. Just a sound in the back of his throat, the involuntary noise of someone watching something that has just clarified a situation they had hoped was more ambiguous. On the screen, Pierce's hand came down on her shoulder. "Pause it," one of the agents said. The frame froze. Pierce's hand on Emily's shoulder. The monitor in the upper left of frame reading 61. The patient's lips, in the camera's resolution, visibly darkened. Albie said, When did his oxygen drop below 70? 40 seconds before the intervention, Nolan said. There's a closer angle from the equipment camera on the east wall. We've already processed both. Albie had a phone in his hand now. He hadn't called anyone yet. He was holding it like he was deciding who to call and in what order. We'll need to speak with Dr. Pierce, one of the other agents said, and we're going to need access to his full case file history, specifically any incidents involving Nurse Carter over the past 14 months. Albie's phone-holding hand tightened almost imperceptibly. That's an internal personnel matter, he said. The words came out like a reflex, like something he'd said before in situations that he'd managed to navigate, and you could hear him recognizing as he said it that this situation was not going to navigate the same way. Yes, Nolan said pleasantly. It is, and we're asking for it. The silence had the particular texture of a situation changing states. Emily watched Albie calculate. She'd watched people calculate before, in the field, in briefing rooms, in the hallways of this hospital, and she'd learned to read the gap between when a person finishes calculating and when they announce the result. Albie took 4 seconds. I'll get you what you need, he said. Pierce was in the physician's lounge when they came for him. Emily didn't see this directly. She heard it from Marcus, who had been in the corridor when 2 of the federal agents walked past him toward the lounge, and who had stationed himself at a point of strategic visibility and watched with the professional, neutral expression of someone who has survived a long time by knowing what is happening without appearing to be paying attention. They went in, Marcus told her, his voice very low, finding her in the consult room doorway. Pierce came out with them. He was talking the whole time, doing the thing he does where he talks a lot and fast because he thinks if he controls the words, he controls what's happening. Did it work? Marcus considered this with the solemnity the question deserved. He's sitting in the administrator's conference room right now with 2 federal agents and Richard Albie, and from what I could see through the window, Pierce is still talking and nobody is nodding. She thought about what that looked like. Pierce in the conference room, the voice still steady and reasonable, the practiced certainty that had carried him through 19 years of situations where being the most confident person in the room had been enough. The agents with their notepads and their particular brand of patience, not the patience of people waiting for Pierce to finish, but the patience of people who are in no hurry because the footage already exists and is not going to change. His whole story, Marcus said, is going to be that you interfered before he could complete his assessment. I know. The cameras are going to say something different. I know. He looked at her. Are you okay? She thought about the question honestly. Her hands were steady. Her chest had that particular tightness that came from extended controlled stress, the kind her body had learned to manage over years of situations where falling apart was not an option. She was tired in a way that the coffee hadn't touched. I'm fine, she said. Then, because Marcus was not a person who deserved dishonesty, I will be. He nodded. He looked like he was going to say something else, and then the sound of footsteps in the corridor made them both turn. It was Dr. Reyes. He was still in his trauma scrubs, which had blood on them that wasn't his, and he had the slightly combusted look of someone who had been in an adrenaline situation and not yet come down from it. He was young, 28, maybe 29, with the kind of earnest intelligence that the residency system was actively trying to beat out of him, and he'd apparently decided that this was the moment to say something. He looked at Emily. Do you have a second? She nodded. He said, I want to make a statement about what happened in the Bay. I want to formally say what I saw. He paused. Pierce told us before you got back in there that the decompression was his call, and that the pen was... He said you acted in a panicked and untrained manner, and that he had approved a modified procedure. Emily was quiet. That's not what happened, Reyes said. No. I was there. I know what happened. He ran a hand through his hair, messing it further. I should have said something in the room. I was going to, and then... He stopped, started again. He's my attending. He controls my evaluation. If I contradict him in front of staff, in front of patients... I know, Emily said. I'm going to make the statement anyway. She looked at him, 28 or 29, scrubs with blood on them, standing in a corridor outside a consult room while federal agents processed whatever was in the conference room at the end of the hall. He was scared. That was visible. But he was standing here, which meant something. Tell them exactly what you saw, she said. Don't interpret it. Don't frame it. Just what happened in the order it happened. He nodded. And Dr. Reyes? He looked up. Thank you. He went. Marcus watched him go and then looked at Emily with an expression that wasn't quite a smile but was adjacent to one. He's going to lose 3 stars on his next evaluation, Marcus said. Maybe. Worth it? She thought about the man in Trauma Bay 3, the blue lips receding, the number climbing from 61 toward 94. Yeah, she said. She wasn't in the conference room when they played the footage for Pierce. She didn't need to be. What happened in that room she would understand later in pieces. From Nolan, who told her what was necessary and nothing more. From Reyes, who had been present for part of it as a witness. And from the particular quality of Pierce's silence that afternoon, which she observed from the corridor and which was unlike any silence she had seen from him in 14 months. The footage showed what it showed. There was not, it turned out, much for his practiced certainty to do with footage. What she did see, at just after 2 in the afternoon, was Richard Albee walking toward her with the expression of a man who has been reconstructing his understanding of a situation for several hours and has arrived at a place he does not enjoy. He stopped in front of her. Dr. Pierce has been placed on administrative leave pending a full review, he said. She held his gaze. Okay. The federal investigators have requested your full employment record. HR is cooperating. He paused. Ms. Carter, I want to be clear that Ironwood takes that if there has been a systemic issue in how certain staff have been... He stopped, started a different sentence. Is there anything you need right now? She thought about the coffee she'd had 4 hours ago, the locker she hadn't been back to, the 14 months she'd spent being careful and deferring and swallowing the thing in her chest that wanted to argue. I need to check on my patient, she said. Albee blinked. Just slightly. Bay 3, she said. Commander Salter. Someone should be monitoring his chest tube output and his oxygen. I'd like to be the one doing it. He looked at her for a moment, recalibrating in the way she was coming to understand that people did when they encountered her, and their expectation didn't match what they found. Of course, he said. Ounce. She put on fresh gloves and went into Bay 3. The room was less crowded than it had been. Most of the agents had moved to the hallway. Maintaining perimeter, she understood, positioned between the patient and any point of entry. One remained inside, stationed near the door. The same contained energy as Nolan, but different in its specifics. Younger. Alert in the way of someone on a second wind. The resident managing Salter's care gave her a brief rundown as she entered. Chest tube draining well, oxygen stable at 96 on 2 liters, blood pressure recovering. Surgery was standing by but hadn't been called down yet because the numbers were moving in the right direction. She checked the drainage, checked the output from the tube, the consistency, the volume. She checked the tape on his IV lines. She did the things that needed doing, in the order they needed to be done, with the same hands that had done the same things in more difficult conditions. Salter's eyes opened while she was adjusting the positioning of the monitor lead on his left hand. Not fully open. The heavy open of someone between sedation and consciousness, but open enough. He looked at her. She wasn't sure how much he was tracking. Probably not much. The drugs and the trauma and the blood loss created a particular kind of blurred awareness that wasn't quite presence. But his eyes were on her face, and she said simply and quietly, "You're at Ironwood Regional. You're stable. You're okay." His eyes stayed on her for another few seconds. Then they closed. She stood there for a moment, hand still on the monitor lead, the steady green line tracing across the screen. The room was quiet. Outside in the corridor, she could hear voices. The agents, the continued sounds of a hospital in lockdown, moving slowly toward the other side of it. She thought, this is not over. Not because of the agents, not because of Pierce in his administrative leave, not because of whatever Albee was going to recommend or not recommend. Those things were their own situation. She'd known from the moment she walked back into Trauma Bay 3 that the next hours and days were going to require navigation she hadn't planned for when she clocked in at 6:58 this morning. But right now, Victor Salter's oxygen was 96 and holding, and that was the thing she could do something about. She started his chart entry. She was 3 lines into it when Marcus appeared in the bay doorway. The agent at the door had blocked him for a moment before, apparently clearing him. Marcus's face had an expression she couldn't immediately read, something that was not quite alarm and not quite excitement, and had the texture of information too large to keep composed. "You need to hear something," he said. She put the chart down. He stepped into the bay, close enough to speak without carrying to the agent at the door, and said, "Bev's been talking to the agents for the past hour." Emily looked at him. "She's not backing Pierce," Marcus said. That's what I'm saying." He paused, like he was deciding how much of the next part to give her at once. "She's not backing Pierce, and she's been in there a long time, and apparently she's been keeping notes." Notes. For 18 months, on incidents, documented, dated. He stopped. "Emily, she kept notes on every time Pierce wrote you up, every incident, every time a patient outcome was affected by a call he made in a situation where you were involved." His voice had gone very quiet. "She told the agent she kept them because she didn't know what else to do with them, and she thought someday someone was going to ask." Emily was quiet for a moment. She thought about Bev. 22 years at Ironwood. The expression on her face that morning when Emily was being walked out. Not surprise, not disapproval, not quite sympathy. Just the face of someone watching something that has happened before. She had read it as resignation. Apparently it had been something else. "How many incidents?" she asked. Marcus met her eyes. "A lot," he said. And in the corridor outside, moving with the particular deliberate speed of someone who has seen the footage and made a decision that is not going to wait, Deputy Director Harlan Mack was walking toward Trauma Bay 3, and he was not alone. Mack came through the bay door with 2 people behind him and the specific energy of someone who had finished gathering information and was now ready to do something with it. He looked at Emily first, then at Salter in the bed, then back at Emily, and she understood that the look at Salter was not clinical. He wasn't checking on the patient. He was checking the distance between the patient and the door, the angles, the positions of people in the room. Old habit, probably not one he was aware of anymore. "With me," he said. She followed him into the corridor. Marcus stepped back to give them room, reading the situation correctly, and the 2 agents who'd come with Mac positioned themselves at either end of the hallway with the practiced casualness of people whose job is to create space without appearing to. Mac stopped at the wall opposite the bay window. He crossed his arms, which she read not as defensiveness but as the posture of a man who thinks better when his hands aren't moving. "We pulled your military record," he said. "I assumed you would. You performed 43 documented field interventions over 3 deployments. 11 of those are categorized as high-complexity emergency procedures performed under active fire or without physician oversight." He paused. "You have a commendation from the 82nd Airborne that most attending physicians in this hospital couldn't qualify for." She didn't say anything to that. "Pierce wrote you up twice," Mac said. "Once for pushing saline. Once for asking about an antibiotic delay in front of residents. It's in my file. Both of those patients had better outcomes than the standard of care averages for their presentations." He let that sit for a moment. "The investigator who pulled your HR file is the same one who spent 2 hours with your charge nurse, Bev Hollis. I heard she had documentation. 18 months of it." Mac uncrossed his arms and put his hands in his pockets, and she had the sense that this was the posture he used when he was about to say something he'd thought carefully about. "Carter, what Hollis gave us is not just notes on you. She documented 11 separate incidents over the past year and a half, where Pierce intervened in patient situations to override nursing assessments, and in 8 of those 11 cases, the patient required escalated care within 6 hours of his intervention. She has dates, patient codes, outcome notations. She was keeping a parallel record." Emily was quiet. She thought about Bev handing her the tablet every morning without eye contact. The face that had watched her being walked out and had said nothing. 22 years at this hospital, 22 years of watching the thing that Ironwood was and finding a way to exist inside it. And apparently all that time she'd been writing things down in whatever private language a person uses when they don't know who to tell, but know they need to tell someone eventually. "Why are you telling me this?" Emily asked. Mac looked at her directly. "Because in about 20 minutes, Pierce's attorney is going to arrive at this hospital, and when that happens, the conversation about what occurred in that trauma bay becomes significantly more complicated. Before that happens, I want your account formally documented by my team, with your military record attached, and I want you to understand what you're walking into." What am I walking into? A physician with 19 years of institutional relationships, a hospital administration that is currently deciding whether to protect itself or do the right thing, and a federal investigation that has about 6 hours of active leverage before lawyers start slowing everything down. He held her gaze. "You've been doing this quietly for 14 months. I'm asking if you want to stop doing it quietly." She thought about the word quietly. She'd chosen quiet because it was survivable, because a combat medic who shows up in a civilian hospital and challenges the hierarchy on her third week doesn't last long enough to help anyone. She'd calculated the value of staying against the cost of staying, and she'd decided that staying, even at the cost of what staying required, was worth it. She looked through the bay window at Salter's monitor. Green line, steady, 96. "Tell me what you need," she said. But the formal documentation took 40 minutes. One of Mac's team, an investigator named Solano, who had the compact efficiency of someone who worked in written language the way surgeons worked in tissue, sat across from Emily at the table in the consult room with a recording device and a structured questionnaire that was more forensic than conversational. He asked her to describe every interaction with Pierce she could recall that had involved a direct conflict over patient care. He asked for dates where she had them and approximate timeframes where she didn't. He asked about the write-ups, the exact language Pierce had used, the presence of witnesses. She gave him everything she had, not everything she felt. She kept that out of it. The 14 months of compressed frustration, the thumbnail pressed into the palm, the particular exhaustion of being competent in a place that needed her to be less so. None of that belonged in a federal document. What belonged was the record. Halfway through the session, Solano paused and looked at something on his tablet. "In October of last year," he said, "there was an incident involving a trauma patient, 49-year-old male, polytrauma from a motor vehicle accident. You flagged an internal bleed that wasn't on the attending's initial assessment. The patient went to emergency surgery 2 hours later." "I remember it." "The attending on that case was Pierce." "Yes." He documented in his notes that he had independently identified the bleed and that your notation was a duplicate of his finding. Solano looked up. "The timestamps on the documentation don't support that." Emily said nothing. She had known about the timestamps. She had looked at that chart 3 days after the incident and seen the timestamps and understood exactly what they meant. And she had sat with that knowledge in the way she sat with most of the things she knew at Ironwood. Useful, filed, not yet actionable. "Did you file a complaint at the time?" Solano asked. "No." "Why not?" She thought about how to say it accurately. "Because I had 2 write-ups in my file and Pierce had 19 years at this institution. Because the complaint process runs through the department chief. Because the department chief was Pierce." She paused. "Because I calculated that a complaint would end my employment and not change anything, and I decided that staying and being present was more useful than being right and gone." Solano looked at her for a moment. He wrote something. "Did anyone else observe the timestamp discrepancy?" he asked. Dr. Reyes reviewed that chart during a training session about 6 weeks later. He would have seen it. Solano nodded and wrote again. Pierce's attorney arrived at 3:47. Emily knew because she heard the change in the quality of noise from the administrative corridor. A specific shift in register, voices becoming slightly more formal, slightly more careful. She was back at the nurses' station by then, not because anyone had told her to go there, but because the hospital was still technically in modified lockdown, and patients still needed care, and she was still a nurse, and there was still work to do. The work helped. It always had. There was something in the specific physical engagement of clinical tasks, the IV checks, the vital assessments, the documentation, the exact procedural language of care, that occupied the part of her brain that would otherwise spend its time on things she couldn't control. Marcus came to stand beside her at the station. "Attorney's here," he said, unnecessarily. "I heard. Albie's in there with them." He was quiet for a moment. "You know what Pierce is going to say?" His attorney is going to say that the footage shows an unauthorized procedure by a non-physician and that whatever the outcome, the process was a violation of scope of practice standards. "I know. That's not nothing, legally." "I know that too." She did know. Scope of practice was real. The lines existed for reasons, even when the reasons occasionally resulted in someone dying while the proper authority figure hesitated. She had crossed a line this morning. She had done it deliberately, and she would do it again, but she had crossed it, and the law did not grade on intent as heavily as the medicine did. "Reyes filed his statement," Marcus said. She looked up. 40 minutes ago. I saw him come out of the investigator's room. He looked like he'd been through something, but he did it." Marcus picked up a chart he didn't need, looking at it without reading it. "Bev is still in with Nolan, has been for a while." She thought about what Bev might be saying. All those months, all those documented incidents, that parallel record kept in whatever system Bev used. A notebook, a personal drive, some mechanism she'd chosen because she'd needed somewhere to put the truth that wasn't the official record that Pierce controlled. It was, Emily thought, a strange kind of solidarity. The woman who'd looked at her military experience and said, "This is a real hospital, honey," and who had, apparently, been quietly furious about what she saw for the better part of 2 years. People were more complicated than the role they played in your story. She'd known that. She just hadn't known exactly how it applied to Bev until now. Her radio chirped. She picked it up. "Carter," said the voice on the other end, the resident managing Salters Bay. "Patients waking up, asking for water and trying to pull at the chest tube. Can you come?" "On my way." Thus, Salter was more conscious than she'd expected. He was fighting the tube, not aggressively, not the confused thrashing of someone emerging from sedation without understanding where they are, but with the deliberate dissatisfaction of a man who has located an intrusion on his body and wants a report on why it's there. She caught his hand before he could work the adhesive tape loose. "Leave it," she said. Not harsh, clear. He looked at her. His eyes were focused now, properly focused, taking her in the way she'd watched people do when they were reassembling their situation from available data. "You're in Ironwood Regional," she said. "Your lung collapsed. The tube is keeping it open. You need it there." He took a breath that was visibly shallow and cautious. The breath of someone who has learned, recently and unpleasantly, that breathing can be negotiated rather than assumed. "Water," he said. His voice was rough. "Ice chips. Not water yet." She reached for the cup the resident had left on the tray, held it for him. He took a chip and held it in his mouth and looked at her with the evaluating expression of someone running a parallel assessment. "You were there," he said. "Earlier." "I was." He was quiet for a moment. His eyes went to the ceiling and then came back to her face. "What did you do?" She told him. Simply, without drama, the way she told anyone what had been done to their body. Because it was their body, and they had a right to the information. Tension pneumothorax, decompression, chest tube. He listened with the focused attention of someone with medical enough training to understand what he was being told. "With a pen," he said. "With a pen." Something moved across his face. Not quite a smile. He was too compromised for that, and probably too reserved by nature, but the acknowledgement of something that had registered. "How long was I out?" "Several hours. It's just past 4 in the afternoon." He processed this. She watched him file it, adjust something internal. "My team," he said. "Deputy Director Mack is in the building. Your team is here." The thing in his expression settled, some immediate tension resolving. The particular relief of a person in an institution-based role whose first cognitive priority after survival is the integrity of the operation they were running. "Okay," he said. She adjusted the tape on the chest tube, checked the drainage output, made a notation. "The doctor," Salter said. "Who was there when I came in? The one who—" He paused. editing something. There was a man who gave an order to remove someone from the room. She kept her voice neutral. Dr. Pierce. Is he still your attending? He's on administrative leave. Salter was quiet for another moment. His eyes were on the ceiling again, and she had the sense that he was moving through a decision tree of some kind, weighing things she didn't have full visibility into. I need to speak with Mac, he said. I'll tell him you're awake. She was moving toward the door when he said her name. She turned. He'd gotten it from somewhere. From someone in the room earlier, from whatever fragments of awareness had filtered through the sedation. He said it correctly, which not everyone did on the first try. Carter? Yes. Thank you. He said it simply, without the particular formality of performance, the way people said it when they meant it specifically, rather than in general. She held his gaze for a moment. I'll get Mac, she said, and went. She found Mac in the corridor outside the administrator's conference room, which was not where she expected him. He was standing with his phone in his hand and an expression she hadn't seen on him before. Not troubled exactly, but the face of a man absorbing something that has changed the shape of the problem. Salter's awake, she said. He's asking for you. Mac nodded, but didn't immediately move. Something happened, she said. It wasn't a question. He looked at her. He made a decision she could see him make. We pulled Pierce's personnel records going back 5 years, he said. Not just the incidents Hollis documented. Full audit. He paused. There are 4 nurses in this hospital who filed informal complaints about Pierce in the past 3 years. All 4 complaints were routed through department administration. All 4 were declined without formal review. He paused again, and this time the pause had more weight in it. 2 of those nurses no longer work here. 1 transferred to a different department. 1 resigned 6 months ago. Emily held this information. The 4th one, Max said, is still here. Her name is Trisha Van. She's a senior nurse in the cardiac unit, and she filed her complaint 14 months ago. He looked at Emily directly. Same week you started. She understood what he was telling her. The picture it made, not a pattern of one person having difficult relationships with nursing staff, not the kind of friction that any senior physician accumulated over a long career. A directed, systematic pattern of identifying nurses who represented a specific kind of challenge and finding ways to eliminate them from the environment. She had been the most recent iteration. Van's coming in, Max said. She's been contacted and she's on her way in from home. She apparently kept documentation, too. He stopped. Carter, I want to be clear about something. What's emerging from this record is not a single incident this morning. It is an institutional pattern with multiple victims and a long timeline. That changes what this investigation is. She understood that, too. What does it change it to? She asked. Mac's phone buzzed. He glanced at it. His expression, which had been controlled and calibrated since the moment she'd met him, did something she hadn't seen it do before. That's my answer, he said, looking at the phone. Then, to her, Pierce's attorney just filed a preemptive statement with the hospital's legal department. It says Pierce is prepared to testify that you have demonstrated a pattern of insubordination and clinical overreach, and that he is pursuing remediation action against staff whose conduct endangered patient safety. He looked up from the phone. He's filing against you. In the conference room behind him, she could see through the narrow window beside the door. Albie at the head of the table, 2 people she didn't recognize on one side. Pierce's attorney, a woman in her 50s with a posture that said she had been in rooms like this many times and had won in most of them, on the other. And Pierce himself, at the far end, looking directly at the window, looking directly at Emily. His expression, across the distance of the glass and the corridor and 14 months of this particular arrangement between them, was composed and certain and absolutely unwaveringly confident. And then Mac's phone buzzed again, and this time when he read it, he said quietly, to no one in particular, "Well." He turned the phone toward her. It was a message from Solano. 3 lines. She read them twice to make sure she had them right. The chest tube drainage documentation from Salter's procedure, time-stamped and logged. The original clinical notation, the first person to log an assessment, the first record in the system of what had been done in that bay, and by whom. The timestamp on that record was Emily Carter's login, 12 minutes before Pierce had entered the room. The record Pierce had just told his attorney he had overseen, the procedure he had framed as his clinical decision, the intervention he was preparing to use as evidence that Emily had dangerously interfered with his management of the patient. That record had her name on it, logged before he'd walked through the door. And the hospital's own system had created a timestamp that was not going to change, regardless of what anyone said in the conference room. Emily looked at the phone, then at the conference room window. Pierce was still looking at her. She looked back at him and kept her face still and waited for him to understand what was about to happen. Mac put the phone in his pocket and walked toward the conference room door without hurrying. Emily stayed in the corridor. She wasn't invited into the conference room, and she didn't need to be. What was happening in there would happen with or without her presence, and she had learned a long time ago that the desire to witness the moment when a thing turns is a human impulse that sometimes gets in the way of the thing actually turning. She stayed where she was. Through the narrow window, she watched Mac enter, watched Pierce's attorney begin to rise, the automatic response of someone accustomed to controlling the terms of entry into a room, and then settle back when Mac put Solano's message on the table in front of Albie. Not Pierce. Albie. She watched Albie read it. She watched Albie's hand go flat on the table. Pierce couldn't see the phone from where he sat. He watched Albie's hand and then looked at his attorney, and something in the quality of his certainty shifted. Not collapsed, not yet, but moved in the way that a very confident structure moves when one load-bearing element changes state. Emily turned away from the window. She had patience to check. Marcus found her in the supply corridor 10 minutes later, which told her he'd been looking. "Van's here," he said. "I heard." She walked straight past the front desk and told them she was there for the federal investigator. Didn't say anything to anyone else. He paused. She looked like someone who had been waiting to do that for a long time. Emily believed it. She knew what it felt like to carry documentation you couldn't use, the particular weight of evidence that exists outside any structure designed to receive it, the way you have to keep recalibrating whether staying silent is practical or complicit. Trisha Van had made her complaint 14 months ago, the same week Emily had started, and whatever had happened to that complaint had apparently made her decide to keep her own record going forward, just in case someone finally asked. Now someone was asking. She went back to the station and picked up the chart she'd been working on before Mac had found her. The documentation work was real. There were 3 other patients on this floor who needed their care continued regardless of what was happening in the conference room. She filled in the vitals, the medication notes, the timestamps that meant something because they were what they said they were. Reyes came by at 4:45, walking with slightly more purpose than usual. He stopped at the station. "They're pulling records from the past 5 years," he said. Not quite whispering. The kind of voice people use when the information is significant enough that they want it moving but not broadcast. Not just Pierce's patient files, purchasing records, equipment orders, scheduling. He picked up a pen from the station and put it down again immediately. Someone told Albie there's a flag on a series of procurement decisions from 2 years ago that Pierce signed off on. Emily looked up from the chart. "Medical supply contracts," Reyes said. "The vendor changed 3 times in 18 months, each time to a more expensive supplier, and the cost differential went into an account that, I don't know all of it, I'm getting this secondhand. But Solano asked me about a particular equipment purchase from September of last year and whether Pierce had any financial relationship with the supplier." She set the pen down. This was the part she hadn't seen coming, which she supposed was the nature of things that exist underneath the surface, you can see. She had spent 14 months watching Pierce defend his authority, protect his position, eliminate threats to the hierarchy he sat at the top of. She had understood it as ego, the need to be the most important person in every room, the inability to tolerate competence that didn't report to him. She had not thought to look underneath the ego for something more structural. But of course, 19 years. The parking spot. The plaque. The roommate in facilities whose job it was to not fix things. The ego was real. The ego was also possibly a very effective cover for something that had nothing to do with ego at all. "Is anyone confirming this?" she asked. "Albie's general counsel is in the building," Reyes said. "Arrived 20 minutes ago. That's not standard for a physician leave situation. No, it wasn't. She looked at the supply corridor, the shelves of materials she stocked and used and documented, the vendor labels on the packaging. She hadn't paid attention to vendor labels. Why would she? She was a nurse. She used what was there. She thought about the IV supplies in the trauma bays, the particular brand of chest tube kit they used, which she had noted in passing because it was slightly different from what she'd trained on in the Army, and she'd had to adjust her handling. It was more expensive than standard issue. She'd assumed it was a quality decision. At 5:15, the conference room door opened and Pierce came out. Not Mac, not Albie. Pierce first, and behind him his attorney, and the attorney's face had undergone a change that legal professionals were trained not to display and had not quite managed to conceal. Pierce walked down the administrative corridor with the bearing of someone who is maintaining posture because posture is the only thing left to maintain. He was still in his white coat. He had not been asked to surrender his badge yet. That would come through HR, through process, through the specific procedural sequence that even this situation required to be followed. But something about the way he moved had changed from the last time she'd seen him. Through the window, looking at her with the certainty of a man who intended to win. He didn't look at her as he passed, not the deliberate avoidance of someone refusing eye contact. He simply did not look, and she understood that she had receded in his processing of the situation from a threat that required management to something else, an element of a larger problem. His attorney stopped briefly and spoke to someone, one of Albie's people, in a low voice that Emily couldn't catch. Then she followed Pierce. Mac came out of the conference room 30 seconds later and walked directly to Emily. "The procurement audit is going to take time," he said. "That part of this moves through different channels. What I can tell you now is that the scope of this investigation has formally expanded beyond this morning's incident." He looked at her steadily. "Which means two things for you. First, the action Pierce filed through hospital legal this afternoon is being stayed pending the investigation. His attorney has been informed." Emily breathed out slowly. "Second," Mac said, "I'm going to need you to be available for the next several days. Not confined, not restricted, but available. There will be more questions." "That's fine." He looked at her for a moment. "You've been on shift since before 7 this morning." "Yes." "Go check on your patient," he said. "Then go home. We'll have someone contact you tonight with the formal interview schedule." She almost said she wasn't tired. She stopped herself because it wasn't true, and Mac was not a person who would appreciate the performance of it. "Okay," she said. "Fine." Salter was sitting up when she came into the bay. Not fully. The head of the bed was raised and the chest tube was still in, and he was still connected to more monitoring equipment than he would like. She could tell that from the specific quality of his restlessness. But he was cogent and present in the way he hadn't been earlier, and he'd apparently had a conversation with Mac that had settled whatever operational concern had been driving him. Mac was gone when she arrived. The agent at the door was different from before. End of a shift rotation, someone fresh. Salter watched her check the drainage, the line pressures, the output volumes. He was the kind of patient who watched what you were doing and why, which she didn't mind. She explained what she was checking and what it indicated, the way she did with any patient who was conscious enough to receive information. "Your numbers are good," she said. "Better than good for where you were this morning." "How long does the tube stay in?" "That's the surgeon's call. Probably another 24 hours minimum, depending on what the follow-up imaging shows." He accepted this. He was quiet for a moment while she updated the documentation. "I heard what Pierce filed," he said. She glanced up. "Mac told me." His voice was still rough but clear. "He filed a complaint claiming you endangered my life." "He did." Salter looked at her steadily. "I want to make a formal statement about what happened. On record. About the procedure and what it resulted in." He paused. "I'm told the footage is being reviewed. I'm adding my account." She kept her voice even. "You don't need to do that on my behalf." "I'm not doing it on your behalf," he said. "I'm doing it because it's accurate and because I was the patient and what's being claimed is wrong." He said this without heat, without drama, with the flat precision of someone who deals in factual records. "Is there a problem with that?" She held his gaze. "No," she said. He nodded, satisfied, and looked at the ceiling in the way of someone who has made a decision and moved on from it. Mac told me about your record, Salter said to the ceiling. Your deployment record. She didn't say anything. I've worked with Army medics in the field. We do coordination with military protective units. He paused. What you did this morning with what you had in your pocket. I've seen the outcome of that situation going the other way. I've seen it multiple times. He stopped again. He was not, she understood, a person who overstated things, which made the lack of overstatement significant. You should be acknowledged for it. The patient's outcomes are the acknowledgement, she said. He looked back at her from the ceiling. That's the right answer, he said, but it's not what I mean. She capped the pen she'd been using to mark the drainage chart, put it back in her breast pocket. A different pen from this morning, same spot. Old habit. Get some sleep, she said. The tube's draining well. She was at the door when he said, Carter. She turned. You're still here, he said. After everything today. You're still here finishing the shift. There are patients on the floor, she said simply, and went. At Pier 6, Marcus walked her out at 6:20. Not because she needed an escort, he fell into step beside her the way he did when he had something to say that required movement, rather than standing still to say it. Bev left an hour ago, he said. She looked, I don't know, not lighter exactly, like someone who put something down they'd been carrying. Emily understood that. She asked about you, Marcus said, before she left. Asked if you were still in the building. What did you tell her? That you were checking patients. He glanced at her. She nodded. That was all. That was probably all that needed to happen for now. The rest of it, whatever Bev and she would eventually say to each other, whatever the space between them would eventually look like, required a different context than this day, this building, this ongoing situation. They pushed through the lobby doors. The lockdown had lifted at 4:30. The external perimeter stood down. Vehicles dispersed. The ambulance bay looked like itself again. The evening air outside was cooler than it had been when she'd arrived 12 hours ago. That particular shift in October air that happened between 6 a.m. and 6 p.m. like the day had changed its mind about what it wanted to be. The procurement thing, Marcus said. If that's real, it appears to be. Pierce wasn't just protecting his ego. He said it with a kind of careful disgust, the tone of someone testing the weight of what they're saying. He had financial reason to keep certain people from getting too close. That's what it looks like. You weren't the first. I may have been the most recent, she said. Van was the one before me. Before her, probably someone else. Marcus walked in silence for a moment. If that procurement thing opens up the way it sounds like it might, he said, Pierce isn't just losing his job. He's losing more than his job. Yes. You knew something was wrong when they wrote you up. I knew what the write-ups were doing. I didn't know why all the way down. He stopped at the edge of the parking lot. She stopped with him. You held on, he said. She looked at him. He was wearing the expression he sometimes had at the end of difficult shifts. Not sad exactly, not tired exactly, but the face of someone taking an accurate accounting of where things stood and what they cost. So did you, she said. So did Bev. So did Reyes today, when it mattered. Reyes is going to get a difficult evaluation cycle. Maybe. She thought about Reyes standing in the corridor in bloody scrubs, saying I should have said something in the room, and then going to say it anyway. Or maybe the evaluation cycle is going to look different from what any of us expected a week from now. Marcus nodded slowly. Go home, he said. You look terrible. Thanks. I mean it in the best way. She almost smiled. It felt strange on her face after the day. She walked to her car, a 6-year-old sedan with a cracked side mirror she hadn't gotten around to replacing and a coffee cup in the holder from 3 days ago. She sat in it for a moment before starting the engine, hands on the wheel, the parking lot quiet around her. She thought about the timestamp on that clinical record. Her name. Her login. 12 minutes before Pierce had entered the room. She thought about Bev's notebook. 18 months of dated entries, 11 incidents, 8 escalations. The particular determination of someone who doesn't know when the moment will come, but intends to be ready for it. She thought about Trisha Van walking past the front desk and saying she was there for the federal investigator. Not asking, saying. She started the car. The call came at 9:40 that evening. She was in her apartment, had eaten something she didn't remember clearly, was sitting on the couch with her phone on the cushion next to her and her eyes on nothing in particular. The number was Nolan's. "We need you to know something before it becomes public," Nolan said, without preamble. "The hospital's internal audit, combined with what our financial team found today, is being referred to the Federal Financial Crimes Division tonight. It's going to move faster than normal because of Salter's involvement. The connection to the protection operation adds a dimension that prioritizes the timeline." Emily waited. Pierce's attorney was informed an hour ago that the scope of the situation exceeds what she was retained to handle. She is withdrawn. A brief pause. He is currently being advised by the hospital's general counsel, who has a conflict of interest he's in the process of identifying. Is he under arrest? Not yet. Arrest requires the financial investigation to reach a threshold, and that takes time even on an expedited track. But he has been formally notified that he is a subject of federal investigation. His credentials have been suspended pending the outcome, not just at Ironwood, that state medical board, and that notification went out this evening. Emily was quiet. "Carter." Nolan's voice shifted slightly. Not warm exactly, but more direct. The drop in register of someone setting aside the procedural voice. "What Pierce filed today against you, the complaint of clinical overreach and insubordination, that complaint, given the investigation now underway, has been formally reviewed by the hospital's legal team and rejected, in writing, as of 40 minutes ago." She sat with that. "Albee is going to call you tomorrow morning," Nolan continued. "I'm telling you now so it doesn't come out of nowhere. He wants to discuss your employment status and what comes next." "Okay," Emily said. "You did good work today," Nolan said. "The patient work and the other work." There was something in the phrase "the other work" that acknowledged what 14 months of document and defer had actually been. Not paralysis, not capitulation, but the specific labor of someone who understood that surviving inside a corrupt system long enough to be present when the system cracked was its own form of strategy. "Thank you," Emily said. After she hung up, she sat in the quiet of her apartment and let the day settle into the shape it was actually going to have, rather than the shape it had felt like inside it. The ceiling was the same ceiling it always was. The coffee cup from 3 days ago was still on the counter where she'd left it that morning. She picked it up and put it in the sink. She was in the bathroom, about to wash her face, when her phone buzzed again. Not a call this time. A text from a number she didn't recognize, which normally she didn't answer. But the text itself made her open it. It was a photo. A document. She could see it was a document, photocopied or scanned, the image quality slightly compressed the way images got when they'd been transferred through multiple steps. She expanded it on her screen. It was a personnel file. Not hers. It was dated 14 months ago, exactly the period she'd arrived at Ironwood, and it was a recommendation form, for hire, the kind of document that sat in the background of employment decisions, the things HR processed and filed and nobody looked at again. The recommendation was for Emily Carter, RN, signed by the hiring manager who'd brought her into Ironwood, and at the bottom, in the section for internal review notation, a signature she recognized, Randall Pierce. He had been in the loop on her hire. He had signed the internal review notation, which meant that from the moment she walked into Ironwood Regional Hospital, Pierce had known exactly who she was, had reviewed her record, had seen the military background and the clinical certifications and the scope of what she was capable of. He had let her be hired, and then he had spent 14 months trying to push her out. She stared at the document. There was a second text from the same number, 4 words, "Ask Albee about this." She looked at the number. Unrecognized. Untraceable by any means she had available to her tonight. Someone inside the hospital, or inside the investigation, or on the edge of both. Someone who had access to the hiring file and had decided, for reasons of their own, that she needed to see this before tomorrow morning. She sat on the edge of the bed and looked at the document again. Pierce had approved her hire knowing what she was. He had brought her in, or allowed her to be brought in, and then systematically worked to diminish, contain, and ultimately eliminate her. The question that the photo on her phone raised and did not answer, was why, not why he'd tried to push her out. She understood that. She'd been a threat from day one, too experienced, too capable, too likely to see the things a man running a quiet financial arrangement needed people not to see. The question was why he'd let her in. She put the phone face down on the nightstand. She lay back on the bed without taking her shoes off, which was something she never did, and looked at the ceiling. Somewhere in the architecture of the last 14 months was an answer to that question, and whatever the answer was, it was going to change the shape of this situation again in a way she hadn't accounted for. Tomorrow, Albie was going to call her. She was going to be ready. She slept 4 hours and woke up before the alarm. That was normal for her. Had been since the army, since the years of interrupted sleep and the body's eventual decision to stop trusting that rest would be allowed to complete itself. She lay in the dark for a few minutes with the phone on the nightstand and the document still on the screen. The brightness dimmed to almost nothing, Pierce's signature at the bottom of a hiring recommendation she had never known existed. She got up, made coffee, stood at the kitchen window while it brewed and watched the street outside, the early light of an October morning doing what October morning light did, arriving without enthusiasm, gray and functional, like it had somewhere else to be. She thought about the question she'd fallen asleep with, not the question of what Pierce had done. That was becoming clearer by the hour, the question of why he'd let her in. By the time the coffee was ready, she had an answer that fit. He hadn't let her in because he wanted her there. He'd let her in because he'd seen her record and calculated that a former Army combat medic with her particular background would serve a purpose in a hospital ER, would make the department look good on paper, would handle the difficult cases that residents flinched from, would be the person who absorbed the hard situations so that the official productivity metrics stayed clean and attractive. He'd looked at her military certifications and her deployment record, and he'd seen utility. A tool. Something useful that could also be controlled, managed, eventually disposed of when it became inconvenient. He had been wrong about the last part. He'd underestimated what happens when you hand a person every reason to document carefully and wait. She drank her coffee and thought about Bev doing the same calculation, years before Emily had arrived, and arriving at the same conclusion, that staying was worth it, that the notebook was worth it, that the dated entries and the patient codes and the outcome notations were worth maintaining even without any certainty that anyone would ever ask. There was something about that, about the decision to keep the record when there was no guarantee it would ever matter, that she found more affecting than she expected. Not inspiring, exactly. More like the particular recognition of a thing you've done yourself, seen from the outside. Albie called at 8:03 am. His voice had the quality of someone who had been awake most of the night and had prepared for this conversation in the manner of people who manage institutions, with documentation, with legal review, with the careful architecture of language that said the right things in the right order. "Miss Carter," he said, "I want to begin by saying that the hospital acknowledges that your employment experience over the past 14 months has been significantly impacted by conduct we are now investigating formally. The write-up's in your file." "Mr. Albie," she said. Not rudely, clearly. "I have a photograph of a document I'd like to ask you about before we go further." Silence. The productive kind. "A hiring recommendation form," she said, "from 14 months ago, with Dr. Pierce's signature in the internal review section." More silence. Longer. "Where did you get that?" he asked. "It was sent to me last night. I don't know by whom." She paused. "Can you tell me what his role in the hiring process was?" Albie was quiet for 4 seconds. She counted. "That form," he said carefully, "is part of a departmental review process that is being examined as part of the current audit." He stopped. Pierce sat on the ER department hiring committee. He would have seen all candidates for ER nursing positions. "Did he flag my application specifically?" He stopped again. She heard him decide something. "Yes, he did. He recommended approval." A pause. "With a notation that your military background would be an asset to the trauma unit." She held the phone and looked at the street outside. A car passed. A woman walked a dog. Normal morning, normal city. "He recruited me," she said. Not a question. "He approved your hire with a favorable notation?" "Yes." and then spent 14 months trying to eliminate me from the department. Albie said nothing, which was its own answer. She understood the full shape of it now. Pierce had seen her record and wanted exactly what she was for his department, a highly capable practitioner whose military background would handle the difficult cases cleanly and effectively. He had not anticipated that the same experience that made her clinically useful would also make her precisely the kind of person who noticed things, kept her own record, and understood the difference between institutional process and institutional truth. He'd brought in the one person whose background made her impossible to fully fool, and then he'd spent 14 months trying to manage that mistake. "Mr. Albie," she said, "I'd like to come in this morning. I have some things to discuss and I'd like to do it in person." "Of course," he said. "Yes, of course." But she arrived at Ironwood at 9:30. It was strange walking in through the main entrance rather than the staff entrance she'd used every shift for 14 months. The lobby looked the same information desk, the same vinyl floors, the same overhead lighting that was slightly too bright in the morning and slightly too dim by afternoon. She had walked through here on her first day, paperwork in hand, with the specific optimism of someone starting something new and the specific guardedness of someone who had been in enough new environments to know that optimism needed managing. She signed in at the desk. The woman behind the desk, someone she recognized from 100 other arrivals, looked at her with an expression that was not quite normal, slightly more careful. The expression of someone who knows more about you than they usually do and is adjusting accordingly. "Ms. Carter," she said, "Mr. Albie's office is expecting you." "Thank you." She took the elevator. On the second floor, through the window that looked down onto the ER floor, she could see the department working. The morning rush, the board filling with names, the staff moving with the particular rhythm of a busy hospital in the first hours of a shift. Normal. Functional. The same work that continued regardless of everything else that had been happening in the administrative layers above it. She looked for the trauma bays. Bay 3, from this angle, was partially obscured, but she could see the monitoring equipment and the edge of the bed, and the bed was occupied, which meant Salter was still there, which meant his numbers were probably still holding in the range they'd been in when she'd left him last night. She let herself note that. Then she went to find Albie. The meeting lasted 2 hours. Not just Albie. His general counsel was there, a woman named Dana Price, who was methodical in the way that good legal minds are methodical. Not cold, but precise, moving through things in the order that made structural sense, rather than emotional sense. 2 of Mac's investigators were present for the first 40 minutes. Solano was there throughout, notebook open, recording device running. They went through the hiring record first. Albie walked her through what the audit had found about Pierce's role on the hiring committee. Not just her hire, but a pattern going back 4 years. The hiring committee had given Pierce significant influence over who came into the ER department. He had, the audit revealed, recommended several hires in that period who could be traced to professional relationships that had financial dimensions. People connected to vendor networks. People who owed him something, or whose continued employment he could use as leverage. Emily had not been one of those people. She was the anomaly, the candidate he'd approved for clinical reasons and then been unable to control. "He spent considerable effort trying to manage you out of the department," Price said. "The 2 write-ups, the removal from Trauma Bay 3 yesterday, these are consistent with a pattern we've now documented across multiple staff members. But you're distinct from the others in that you were never financially connected to him. You were just good at your job and paying attention." "That was the problem," Emily said. "For him, yes." Solano looked up from his notebook. "The financial investigation is going to take time. What we can tell you now is that the preliminary findings support federal charges related to procurement fraud. The timeline goes back approximately 3 years. The total figure involved is still being calculated, but it is significant." Emily thought about the vendor labels on the chest tube kits. The slightly more expensive than standard supplies on every shelf in every trauma bay. Small margins, scaled up over 3 years of procurement decisions, accumulated into something that had justified all of this. The write-ups, the notebooks, the nurses who'd left, the 14 months she'd spent pressing her thumbnail into her palm. "What happens to the write-ups in my file?" she asked. Price looked at her. "They've been formally expunged. As of this morning, HR has updated your record." She paused. "The hospital is also prepared to offer a formal written apology for the circumstances of your employment experience. That's separate from any... We're not asking you to..." "I'm not planning to sue," Emily said. Price looked mildly surprised and then professionally not surprised. "I just want my record clean," Emily said. "I want the write-ups gone, and I want what I actually did in that bay documented accurately." She paused. "And I want to go back to work." Albee, who had been quiet for the past 20 minutes in the way of someone listening carefully to things that implicate him in having allowed a situation to continue, looked at her across the table. "Ms. Carter," he said, "I want to discuss that specifically. Going back to work. What that looks like." He glanced at Price, then back at Emily. "We are in the process of restructuring the ER department in the wake of Pierce's suspension. The department needs... The training protocols need review. The supervision structure needs redesign. We are looking at who should be leading that process." He stopped. "Your name has come up." She looked at him. "Your clinical record, your military background, the documentation that has emerged over the past 24 hours about your actual scope of practice and expertise." He chose his words carefully. "There's a role being considered. Trauma training coordinator, overseeing the development of emergency protocols and the training of both nursing and resident staff in advanced trauma response." He paused. "It would be a leadership role, different from your current position." She sat with that for a moment. She thought about the residents in Trauma Bay 3 yesterday morning, the one on the wrong side of the bed, the one who'd reached for the chest tube tray when she called for it. She thought about Reyes, who had understood what was happening and had been afraid to say so, and had said so anyway. She thought about the years of field medicine that she'd been using quietly, in the margins of what she was officially allowed to do, because the official version of her role had been defined by a man who needed her to be less than she was. "I'd want to structure the curriculum myself," she said. "Yes," Albee said. "That's the expectation. Based on field protocols as well as clinical. The military trauma standards are more aggressive than what's currently being taught in civilian ER residency. There's a gap, and it costs outcomes." "I know," he said. "We want you to close it." She looked at him for a long moment. He was not a bad man, she thought. He was a man who had built a career on managing the middle ground between what institutions should be and what they were. And he had managed that middle ground, one compromise at a time, until he was standing in a room trying to undo 14 months of damage he'd enabled by not looking at it closely enough. That was not nothing. It was also not everything, but it was what it was. "I'll need that in writing," she said. "Full scope of role, reporting structure, and authority over curriculum decisions, before I agree to anything." "You'll have it by end of day," Price said. She left the administrative suite at 11:40 and took the stairs down because the elevator would have required standing still, and she wasn't ready to stand still yet. In the stairwell, between the second and first floor, she stopped on the landing and put her back against the wall and let herself feel the weight of the last 30 hours in the specific, physical way she usually didn't allow when there was still work to be done. Her hands were steady. Her chest had that tightness again, the residual compression of extended controlled stress. But underneath it, something else. Something that wasn't relief exactly, because relief implied a problem resolved, and problems of this scale didn't resolve so much as shift into different configurations. More like the particular dropping of a thing that had been heavy enough to change the way you walked. She breathed in, breathed out. Then she pushed off the wall and went to check on Salter. He was awake and had graduated from ice chips to water, which told her the surgical team had been by and cleared his swallowing function, which was a good sign. The chest tube was still in, but the output had slowed to the range that indicated things were healing in the way they were supposed to heal. His color was normal. Both sides of his chest were rising evenly. She updated his chart from the doorway. He saw her. "Carter, how's the pain?" "Managed." He said it the way people said it when they mean it's there, but it's not running the situation. "Sit down." She pulled the chair from against the wall, sat. He looked at her with the evaluating directness she was coming to understand was simply how he looked at things. Not aggressive, thorough. I gave my statement this morning, he said. Full account of what I was aware of in the Bay. I also contacted my office about your military service record. He paused. There's a commendation process for civilian practitioners who perform life-saving interventions in connection with federal protective operations. My office is initiating it. She started to speak. It's not optional, he said. Not unkindly. It's procedural. You performed a life-saving intervention on a federal protective officer during an active operation. The commendation is generated by the event, not by your preference. She sat with that. I'm also, he said, going to be speaking at the formal review that's being scheduled. The hospital board meeting. There's going to be a public component. He looked at her steadily. You should be there. I will be, she said. He nodded. You said yesterday, he said, when I thanked you. You said you just did your job. I did. I've been thinking about that. He looked at the ceiling for a moment, the thinking posture she'd observed before. 14 months. Working under someone who was actively working against you. Doing the job anyway, keeping your record clean. Waiting. He came back to her face. That's not just doing your job. That takes something most people don't have enough of. She didn't know what to say to that, so she said the true thing. I didn't always know if it was going to matter. No, he said. That's the part that takes something. Pierce was arrested at 2:17 in the afternoon. Emily wasn't there. She was in the ER, covering a half shift at the charge nurse's request because 2 staff had called out, and the board was filling faster than the available hands could manage it. She heard about the arrest from Marcus, who texted her 3 words, "It just happened," and then appeared in the department 20 minutes later with the look of someone who had seen something and was still processing the shape of it. Parking lot, Marcus said quietly, at the station. 2 federal vehicles. He came out of the building. I don't know why he was still in the building. His lawyer withdrew yesterday, but he was here, and they were waiting. She kept her eyes on the chart she was updating. There was no scene, Marcus said. He walked with them, which I expected, honestly. He's not the kind of person who makes a scene. He saves that for private. He paused. But people saw it. Staff saw it. The people at the front desk, couple of residents on break. It wasn't private. She finished the chart entry. Set it down. How's the board looking? She asked. Marcus stared at her for a moment. Then he picked up the board tablet and handed it to her. They worked the afternoon together. The hospital board convened 3 days later in the main conference center on the 4th floor. It was not a small meeting. Emily had attended board-adjacent meetings before, quality reviews, departmental briefings, and they had the contained, procedural quality of institutional gatherings designed to process rather than communicate. This one was different. The room held the board members, the administrative team, legal representatives, and, by what Albie had described as a first, several federal officials, including Deputy Director Mack, and 2 people from the Office of Protective Operations whose titles Emily hadn't caught. The press had been informed. Not invited into the room, but informed, which meant there were people outside with equipment and questions, and the particular atmospheric pressure that created had filtered into the building and was perceptible in the way people moved and spoke. Salter was not present. He was 3 days post-procedure and had been transferred to a facility better suited to his recovery the day before. He had sent a written statement, which Mack read into the record. Emily sat in the second row and listened to Salter's words in Mack's voice and tried not to let the weight of them show on her face. The statement was precise and factual and left nothing ambiguous about what had occurred in Trauma Bay 3. It named her. It named Pierce. It described the sequence of events in the specific, unembellished language of someone who dealt in operational accuracy and had no patience for any other kind. The final line of the statement read, Commander Salter wishes to formally acknowledge that Emily Carter's immediate recognition and treatment of his condition, performed with improvised equipment in the absence of physician action, is the direct cause of his survival. The room was quiet when Mack finished reading. Then the board chair spoke. He was a man Emily had seen in the building exactly once before, at a quarterly event she'd attended during her first month. He had the manner of someone accustomed to making institutional language do real work, and today he appeared to have decided that the institutional language needed to be as plain as possible. He said that the board had completed its initial review of the employment records, the procurement audit findings, the HR complaints, and the security footage from Trauma Bay 3. He said that the formal conclusion of that review was that Ironwood Regional Hospital had failed, through inadequate oversight and an insufficient complaint process, to identify and address a pattern of conduct by Dr. Randall Pierce that had harmed multiple employees and endangered patient care over a period of not less than 3 years. He said Pierce's hospital credentials had been permanently revoked, and the state medical board had been notified, and that the federal financial investigation was proceeding separately and the hospital was cooperating fully. He said, "We failed the staff who came forward with complaints. We failed the staff who did not feel safe coming forward. And we failed a member of our nursing team whose record, as we now understand it, represents the kind of clinical expertise and professional integrity that this institution should have been working to support rather than allowing to be undermined." He looked at Emily, not pointedly, steadily. "Ms. Carter," he said, "on behalf of this board, I want to say clearly and on the record that what was done to you during your time at this institution was wrong. The formal apology from this board is included in the meeting record." She held his gaze and nodded once. She was not going to cry in this room. She was clear about that. She had held too many things too steadily for too long to lose that steadiness now, in the moment when holding it no longer cost anything. But something in her chest moved, not dramatically, not in the way that makes itself visible, but the specific internal shift of a thing that has been in tension for a very long time, finally releasing. 14 months. She had clocked in every morning and done the work and filed the right documentation and deferred when deferring made sense and swallowed the thing that wanted to argue and pressed her thumbnail into her palm and kept going. It had mattered. Not because she'd needed this room to tell her it had mattered. She'd known what she'd done in that bay. She'd known what the timestamps showed. She'd known what Bev's notebook contained. But because the mattering had been, until this morning, private. Held in the space between what she knew and what could be spoken aloud in rooms that counted. Now it was in the room that counted, on the record, said by people with the authority to say it in a way that would not be revised. That was worth something. She let herself feel that it was worth something. Bev was waiting outside the conference center afterward. Not dramatically. She was just standing in the hallway with her hands around a coffee cup that was probably cold because Bev always let her coffee go cold. Emily had noticed that about her from the first week. She had the same face she usually had, composed, experienced, slightly worn at the edges, and she looked at Emily when Emily came through the door and said, "That was overdue." "Yes," Emily said. Bev looked at the coffee in her hands. "The notebooks. I want you to know I didn't keep them because I knew it would go anywhere. I kept them because I didn't know what else to do with what I was watching." "I know. I should have found somewhere to take them sooner." "Maybe," Emily said. "Or maybe you took them somewhere the moment there was somewhere to take them." Bev looked at her. There was something in that look that was not quite apology and not quite absolution. More like two people recognizing that the shape of a situation is more complicated than either of them had been able to see from inside it, and that complication is not the same as failure. "You're staying?" Bev asked. "I'm staying." Bev nodded. She seemed satisfied with that in the specific way of someone for whom institutional continuity was a value that didn't require explanation. "The trauma coordinator position," Bev said. "You'll be good at it." "I'll be honest at it," Emily said, "which is different." Something moved at the corner of Bev's expression that was probably as close to a smile as Bev got in a hospital hallway. Reyes found her at the elevator. He was in scrubs, on a break from what was clearly a busy shift, still doing the slightly combusted thing he'd been doing since yesterday, and he said, "They're posting the board statement on the hospital intranet. Full text." "I know. Everyone's going to read it." "I know that too." He looked at her with the earnest directness that the residency system hadn't managed to fully sand out of him yet. "For what it's worth," he said, "the residents, the ones who were in the bay that morning, we've been talking. And I just want you to know that when you're running the trauma curriculum, we're going to be there. All of us." She looked at him, 28 or 29, bloody Scrubs energy. The person who had said her name in the trauma bay when no one was going to say it, and then had gone to say the harder thing in a federal interview despite the cost. Good, she said, because I'm going to make it harder than what you're used to. He blinked. Then he almost smiled. Yeah, okay. The elevator opened. She got in. She was back in the ER at 1:30. She'd been told she didn't have to cover a shift today. Albie had said take the week, with genuine intention behind it. She thanked him and meant it, and then changed into Scrubs anyway, because the board meeting and the hallway conversations and the weight of the past 4 days had accumulated into something that needed discharge, and the only discharge that worked for her was the work itself. The board was full. It was always full. That was the nature of emergency medicine. No resolution was ever so complete that the board went empty, no day so significant that the patient stopped arriving. There was a woman in Bay 2 whose potassium was dropping and needed monitoring. There was a man in the waiting room who'd been there 40 minutes and whose presentation, based on what she could see from the station, warranted moving up the queue. There was a resident at the far end of the corridor who was looking at a chart with the expression of someone who has found something and doesn't know what to do with it yet. She went to the resident first. His name was Park, 2nd year, and he'd been at Ironwood 4 months. She'd spoken to him twice before today. "What do you have?" she asked. He showed her the chart. She looked at it. Then she looked at the bay where the patient was. "What's your read?" she asked. He told her his read. It was good, not complete. There was a finding he'd weighted incorrectly and a timeline he'd underestimated. But the foundation of it was sound. He'd seen what was there. He just didn't know yet how to build on what he saw. She walked him through it, not taking it from him, showing him the path between what he'd found and what it meant. He asked a question. She answered it. He asked another one. She answered that too, and the answer led somewhere he hadn't expected, and she watched him adjust his understanding in real time. The specific recalibration of a mind encountering information that reorganizes what it thought it knew. That was it. That was the thing she was good at, the thing that had not been allowed to fully exist in this department for 14 months. And that was going to exist now because she had held on long enough to be in the position to make it exist. This was what the curriculum was going to be built on, not the procedures. The procedures could be taught. The procedures were teachable in a week. The judgment. The gap between seeing a finding and knowing what it means. The specific, unglamorous, life-saving work of training people to think clearly when everything is moving too fast and the stakes are too high and the room is full of people who are scared. Pierce had spent 3 years exploiting an institution that ran on that gap, the space between what should happen and what actually does. Emily had spent 14 months living inside that gap, watching it, learning its shape. Now she was going to close it. At 4 o'clock, Marcus appeared at the station with 2 cups of coffee that were not from the machine nobody touched. "Where did you get those?" she asked. "New place opened on the corner. I went during my break." He set one in front of her. "You look like you're already planning the curriculum." "I am." "Going to be hard?" "It's going to be accurate," she said, "which will feel hard to some people." He drank his coffee and looked at the board. "You know they're going to write about it, the story. Woman saves federal officer with a ballpoint pen, corrupt doctor arrested, whole thing." "I know." "You okay with that?" She thought about it honestly. She didn't love the attention. She never had. She had never wanted to be noticed for anything other than what she actually did. And being noticed for what she actually did was complicated by the fact that what she actually did was usually most visible in the worst moments of someone else's day. "I'll be okay with it," she said, "as long as it's accurate." Marcus nodded. He looked at the board again. "4 patients waiting," he said. "I know." She picked up the tablet. "Let's go." Fulcum. The formal commendation from the Office of Protective Operations arrived in writing 6 days later. It cited her military service, her combat medical record, and the specific intervention on October 14th, and it used language that she read twice, alone in her apartment, before she put it down on the table and sat with it for a while. The language was official and precise and impersonal in the way that institutional language had to be. But underneath the official language was a fact. A record existed now, that said what she had done and who she was and that it had mattered. A record that could not be revised by a department chief's write-up or a 19-year institutional relationship or a well-practiced voice that had learned to sound reasonable in high-stakes situations. She pinned it to the wall above her desk, not prominently, to the side where she could see it without looking directly at it. Then she opened her laptop and started building the first module of the trauma curriculum. She started with the section on recognition, the specific clinical skills involved in identifying a life-threatening condition in the first 60 seconds of patient contact, before the chart is complete, before the labs are back, in the gap between arrival and information, where most of the decisions that matter get made. She wrote for 2 hours without stopping, and what she wrote was not academic and was not theoretical. It was built from field, from experience, from the specific texture of situations where the right decision had to be made faster than the protocol could be consulted, and by a person who was tired and scared and operating at the edge of what they knew. It was the hardest thing she'd ever tried to teach, and it was the most important, and she had spent her whole career itan, the deployments, the 14 months, the pen in her breast pocket, all of it, becoming someone who knew how. Pierce was formally charged 9 days after the arrest. The charges included federal procurement fraud, falsification of medical records, and abuse of authority. His medical license was under suspension pending outcome, which his attorney had apparently indicated could take years to resolve. He would not practice medicine in the meantime. He would likely not practice medicine again. Trisha Van came back to the floor the week after the board meeting. They met in the corridor, briefly, without arrangement. She was a woman in her late 40s with quiet eyes and the specific economy of movement of someone who had learned to take up less space than she needed and was still in the process of unlearning it. They shook hands. "Thank you," Emily said. "You too," Van said. That was it. That was all it needed to be. The recognition between two people who had done the same quiet, costly, necessary thing without knowing the other was doing it, across different years and different circumstances, until the moment when it converged into something that couldn't be ignored. Some things didn't need more words than that. The words were in the record. The record was accurate. The record would hold. On a Thursday morning in November, 3 weeks after the 14th of October, Emily Carter clocked in at 6:58 and picked up the board and started her shift. She was the same person who had walked in 14 months ago with her Army discharge papers and her certification stack, and the particular guarded optimism of someone who knew that new environments required calibration. Except that she was not quite the same. The calibration had happened. The cost of it was real. The result of it was real too, and the result was here, this department, this floor, the curriculum she was building in the evenings, the residents who showed up to her first training session with the specific nervous energy of people who had heard it was going to be harder than what they were used to. It was going to be harder. That was the point. The board was full. It was always full. She looked at it, the names and the bay numbers and the flags that indicated what needed doing and in what order. She thought about a ballpoint pen in a breast pocket. The specific pressure of knowing what was happening in a room full of people who had paused in the gap between knowing and doing. The choice to move when moving was the right thing, regardless of what it cost. She thought, that is what I am going to teach them. Not the pen, not the specific procedure that could be learned in an afternoon. The part underneath it, the refusal to freeze, the willingness to act on what you know, when what you know is the only thing standing between someone and the worst outcome. The capacity to do the right thing in the gap where nobody is watching and nobody is going to give you permission and the only authority available is your own judgment and the years you spent earning it. That part could not be written into a protocol. It had to be built the way she'd built it. Through the field, through the deployments, through 14 months of pressing her thumbnail into her palm and showing up and staying and waiting for the moment when staying finally, definitively, mattered. She put the board down. She picked up her pen, same breast pocket, same spot, and went to see her first patient. Some people spend years being dismissed, underestimated, and pushed to the edges of the rooms where decisions are made. They are told, in various ways, that their experience doesn't count, their judgment isn't trusted, their presence is tolerated rather than valued. And some of them, not all but some, make the choice to stay anyway, to keep the record, To do the work at the highest level they're capable of, even when that level isn't recognized. To wait, not passively, not without cost.